I'm not really planning to talk a lot about the treatment options for anxiety, but the cognitive behavioral therapy can be quite successful. And of course, there are medications that can be used to treat anxiety. Like antidepressants, the anxiety drugs take several weeks to take effect. And this is an important part of the treatment protocol. And in some cases, starting the treatment with drugs actually exacerbates the symptoms and could lead to suicidal ideation and in extreme cases even to suicide attempts. So especially with these antidepressants that work on most of them work on the serotonergic system because they are specific serotonin reuptake inhibitors. The patients need to be followed carefully for signs of exacerbation of symptoms. Now, once the drug takes effect, the symptoms should gradually go down to a manageable level. And I've experienced that when I started taking Lexapro for my anxiety attacks, is that I actually felt a little more anxious while the drug was taking its effect, but then once it became effective several weeks later, the entire anxiety type feelings that I had disappeared. Now, when you look at the list of medications, it is quite long. There's many antidepressants and some other options as well. And part of that probably is that, like obsessive compulsive disorder, anxiety is also a very heterogeneous type of disorder. There are probably different genetic factors, such as serotonergic or a dopaminergic type of pathways that might be involved in different people. There may be different environmental triggers for anxiety to occur in different people. And as a result, there's probably quite a variety of brain mechanisms that account for not only the 8 or 10 major different types of anxiety disorders, but also those different types of neural pathways may actually vary among individuals within the same category of anxiety disorders. So one person may respond to one drug, whereas another person may not respond to that drug, and they need to take another drug because their neural mechanisms are slightly different, although maybe the symptoms are kind of similar. So here I talked a little bit about the gene-environment interactions, and this is a really interesting phenomenon because certain genes may give you susceptibility to develop anxiety in a certain type of environment. Whereas other people may have genes that make them more susceptible, but they might be triggered in a completely different type of environment. So for example, one person may have a genotype that's susceptible to repeated type of traumatic events, or another person may have genetic susceptibility in the context of alcohol and drug abuse. So this type of gene and environmental interaction is very interesting, and it shows also how complex the neural mechanisms are that underlie the anxiety disorders that you've seen and were described in quite some detail earlier in this module.